Hello everyone, this is Dr. Paul Ras, Profemina Clinic in Palma de Mallorca, and I'm coming back to you with the second part on COVID-19 and pregnancy. There is still very little information on this topic. Most of the information we did get were studies published from the experience they made in Wuhan, in China, and it's about 150 pregnancies and births. But I'm quite sure that in the near future we will get more and more information as now this disease is spreading around the world. But let me share with you what we know up to now. And you can find a list of some literature to this topic down below. The infection rate of pregnant women is probably exactly the same as any other women, and not higher, but not less either. Initial symptoms of COVID-19 will be exactly the same in pregnant women as in non-pregnant women, usually being a little bit of fever, dry cough and fatigue. But also in pregnant women this can lead to impairment of breathing. If I do get COVID-19 as a pregnant woman during my pregnancy, well, how will this affect my pregnancy? We do know that pregnant women have a different immune response to viruses, as we have known for already many years. And we would expect this disease to be more severe in pregnant women than non-pregnant women, as we have observed in pregnant women who went through the flu. There are data suggesting that pregnant women with COVID-19 in the third trimester can present more severe symptoms and present more severe illness. There seems to be a higher risk of preterm birth, which would mean getting your baby before the 37th week. This occurs in about 41% of the cases. There's also a tendency for more cesareans in COVID-19 positive women giving birth. And it cannot be excluded that there might be a higher incidence of fetuses suffering during labor. And this is something I can imagine very well, because if women who are going through the COVID-19 disease and get impairment of their breathing, they have breathing difficulties, their oxygen levels will go down, which will mean that also the baby is getting less oxygen, and this would result in fetal distress. It seems to be very promising that at least up to now we have no data suggesting that there is an increased risk of miscarriage or early pregnancy loss in COVID-19 in the pregnancy. What about my baby then? There's no evidence currently that this virus is teratogenic. So it seems to be not causing any malformations in babies. But you do need to know that pregnancy is a long time, it's 9 months, and we only know this virus, this new virus, since about December 2019. So all women that were pregnant in the first trimester at that time, let's say December 19, January, February 2020, will give birth in summer this year. And we will have to wait until then to know more exactly about how this disease, COVID-19, will act on the embryo. We have recently some evidence that, some good evidence too, that this disease, this virus can be transmitted vertically. This means that when a woman gets infected in her pregnancy, the virus can go through her bloodstream, over the placenta to the baby, and the baby gets ill. This we know because we found babies that present IgG and IgM antibodies. Antigen is the virus. Antibodies is that what neutralizes the virus. The IgG is something that comes later and can pass the placenta. So if the woman has passed the disease, she will produce IgG, which will go over the placenta to the baby. But IgM, which you have in the beginning of your antibody attack against the virus, this IgM will not pass through the placenta, And we did find IgM in babies, so this must be IgM that these babies produced themselves, proving that they had this disease inside the womb of their mother. But at the moment we don't know the significance of this. Up to now everything seems to be very positive, except for example, there was this one baby, the Illinois baby, that has been found 6 weeks old and died, and they found the SARS-CoV-2 virus in the baby. I have no further information on this, and I didn't see any autopsy report or whatever, but it does raise the question if this baby died because of the coronavirus or with the coronavirus. I can imagine myself that this baby might have experienced a sudden infant death, or also called cot death, and was not due to the coronavirus. But we will see. There's still many things we have to learn, many things will still have to be proven. Another thing is that I'm very happy, I can say at the moment at least, that in breast milk samples they did not find the coronavirus, the SARS-CoV-2 virus. What about feeding my baby? Is it possible to give breast milk? Or is it better to give formula? The main risk of breastfeeding for infants, if you have the COVID-19 disease, is the close contact that the mother has with the baby during breastfeeding. And it is likely that because of droplets that you produce when you are speaking, when you're humming, when you're coughing, that this can go to your baby. But still, I do think that the benefits of breastfeeding outweigh any potential risks of transmission of the virus. You might follow following guidance to reduce the risk of your baby getting infected. So following precautions could help. First and for all, hand washing and disinfecting your hands before you get your baby, before you breast pump, before you take the bottle. Avoid coughing or sneezing when you have your baby in your arm. Or even better, consider wearing a face mask where the droplets will stay inside the mask or between your mouth and the mask, and you have less risk of the baby getting infected by these droplets. If you are using a breast pump, then please follow the instructions that go with the breast pump, how to clean it, how to disinfect, for example, the bottles and so on. And if you are so ill that you are not really able to breastfeed your baby, then ask another person to feed your baby. And please consider that breastfeeding is the best source of nutrition for your newborn baby. Another thing you should consider is that breastfeeding can prevent serious infections like, for example, whooping cough. What is my advice concerning your appointments now in this COVID-19 time? Well, first and foremost, maternity care is very essential, and it has been developed over many, many years, and it had more and more success in reducing the complications both in mothers and in the babies. The risk you would get not attending this care, based on the many years we have done in research before, can lead that there is a higher risk for you or even for your baby at the time you give birth. So, even in the context of the coronavirus, I would very much, and I think it is very important that you continue to attend your scheduled routine care when you feel well. If you have symptoms of the coronavirus, if you have fever, if you have a dry cough, if you are getting any flu-like symptoms, you should get in contact with the hospitals over the emergency line that you know for your place, your area where you live. please, in this case, do not attend your routine clinic. Another thing is that attending the clinic is very important, but please come with a minimum of people and leave your children at home. Now, what if you do get COVID-19 in pregnancy? Well, the first thing you should need to know is that you should not come to your regular routine checks. You will have to wait until after the time, usually this will be 14 days, that you will be confirmed to your place in self-isolation until we can attend you again, and then we will catch up as well as we can with the appointments that you could not attend. If you have a very urgent obstetrical problem in that time, then please call us and we will try to figure out if we can help you on the phone. And if not, you will have to go to a hospital with the special accommodations to help people with the COVID-19 disease. What about giving birth? Well, at the end of the 9 months, or maybe a little bit earlier, any woman will have to give birth. This information I'm going to give you now is especially for the patients of the Profemina clinic in Palma de Mallorca, and these guidelines could be different in the area where you live, depends on where you live. If you have no symptoms of COVID-19 and you're over 35 weeks of pregnancy, you should go to the hospital when any other woman should go to the hospital to give birth. When you have regular contractions, when you have broken waters, or when you have a strong bleed, which is stronger than, let's say, a menstruation bleed. Now, our patients would go to the Clínica Palma Planas here in Palma, and they will make a test for the SARS-CoV-2 virus. Now, there are 3 possible situations. 1, the test will be negative. 2, the test will be positive. 3, you don't have any time to wait until the test is finished, because it takes up to 4 hours to get the result of the test. So now, if you are lucky and you are negative, then we will try to do the best to do birthing and helping you assist your birth the same way we would do in any other situation before the COVID-19. And you can go to the delivery ward, you will be attended by the midwife, and your husband can be with you. Number 2, you are positive. If you are positive, you will be transferred to a hospital specially equipped for the COVID-19 patients, like the San Espaces University Hospital or the Clínica. The third possibility, that you waited too long, or it's a second or third baby and it comes really fast and we have no time to wait for the results, and you have no symptoms of the COVID-19 disease, then you will be considered possibly positive and you will be monitored and you will have your baby in a separate delivery ward special for maybe positive patients, which means that your husband cannot be with you, and medical staff will need to wear personal protective equipment and cannot come in with you all the time, or not as often as we would do in a normal situation. Now, some general information about birthing and COVID-19. There is no evidence up to now that you could not get an epidural or spinal anesthesia. So if you would like to reduce the pain during labor or birthing, you can do this using an epidural. It's safe. Because they found in the Chinese studies that some people, some fetuses do get distressed during birth, I would recommend, and I think this is a recommendation of many of my colleagues, continuous electronic fetal monitoring during labor and birthing. There is currently no evidence that one type of birthing is better than the other one. So I guess that the many cesareans they did was just precautious and not because it was really necessary. So my opinion is that if you want to have a natural birth, vaginal birth, you should go for it. And if before you were already thinking about having a planned cesarean, this would be fine too. It doesn't change anything. Unless the COVID-19 disease in the third trimester gives you problems breathing and your oxygen levels go down, which can mean that your baby really gets distressed and a cesarean section will be necessary to save the good health of your baby. Please avoid the use of birthing pools because, well, my patients will know that I am not very much in favor of giving birth in water because I guess this is something which is not natural for human beings to do. But I do respect the use of birthing pools before you give birth to reduce the pain and the discomfort you have during labor. I agree with that. But especially in this case, the staff will not have the possibility to be protected enough when you are in the water. And the second thing is that the virus is in the feces, and when your baby comes out, it's not only the baby, everything else is getting into this water and your baby can get infected. We will update as we will get more information on pregnancy, birthing and breastfeeding in the context of the COVID-19. Thank you very much for listening to me and see you again.